Ever wondered what causes bad breath? An unpleasant odor that can sabotage your confidence and social life? Well, it's time to delve into this mystery. Bad breath, or halitosis, is often linked to what we eat or our dental hygiene. But it's not always that simple. There are surprising sources, some hidden deep within our bodies, that can contribute to this stinky situation. The causes can range from mundane to complex, and understanding them can help us combat this nuisance. Stay tuned as we unravel the scientific reasons behind this embarrassing phenomenon. Bad breath or halitosis isn't just about what you eat or drink. It's a fascinating, if somewhat unsavory, blend of science and biology playing out right inside your mouth. Let's break it down. Bad breath often starts with poor dental hygiene. When we don't brush and floss regularly, food particles can linger, providing a veritable feast for bacteria. These bacteria are the real culprits behind bad breath. As they chow down on these leftovers, they produce waste products, including sulfur compounds. If you've ever been near a rotten egg, you know how pungent these compounds can be. Now, imagine them on your breath. Not a pretty picture, is it? And then there's dry mouth. Our saliva is like an unsung hero, constantly washing away bacteria and food particles. But when saliva production slows down, as it does during sleep or due to certain medications or diseases, bacteria have a field day. The result? More sulfur compounds and yes, worse breath. Gum disease or periodontitis is another major player in the bad breath drama. This condition creates pockets of infection in the gums where bacteria can thrive, once again leading to the production of those smelly sulfur compounds. But let's not forget about certain medical conditions. Diseases like diabetes, liver disease, and certain digestive disorders can cause distinct types of bad breath. For instance, uncontrolled diabetes can lead to a sweet, fruity breath, while kidney disease can result in a breath that smells like ammonia. In these cases, bad breath can be an early warning sign of more serious health issues. So, let's circle back to our original point. Bad breath is not just about your garlic-laden lunch or your morning coffee. It's a complex interplay of hygiene, biology, and health. And while it's often brushed off as a minor annoyance, it can sometimes be a signal that something's not quite right in your body. So it's clear that bad breath can be more than just a social inconvenience. It could be a sign of underlying health issues. You might think that bad breath is solely linked to garlic and onions, but that's just scratching the surface. Let's debunk some common myths swirling around this topic. First, the belief that bad breath is always linked to food. While certain foods can contribute, they're not the only culprits. In fact, poor oral hygiene, dry mouth, or even certain medical conditions can lead to bad breath too. Another misconception is that mouthwash alone can solve the problem. While it might provide temporary relief, it's not a permanent solution. Mouthwash can mask odors, but it doesn't address the root cause of bad breath, which could be bacteria buildup or gum disease. And let's not forget the myth that bad breath is a sign of serious illness. While it can be a symptom, it's not always the case. There are many benign reasons for bad breath. As we've learned, the causes of bad breath are more complex and varied than most people think. Now that we've debunked some myths, let's summarize what we've learned about the causes of bad breath. Foremost, oral hygiene, or rather the lack of it, plays a significant role in giving rise to bad breath. When we don't brush or floss regularly, food particles remain trapped in our teeth and gums. These particles over time decay and release foul-smelling gases, resulting in bad breath. Secondly, saliva production is essential. Saliva helps in the digestion process and keeps our mouth moist. It also cleanses the mouth by washing away food particles and bacteria. When saliva production decreases, as it does during sleep or due to certain medications, the mouth gets dry, leading to morning breath or medication-induced bad breath. Next, we should not overlook potential underlying health conditions. Issues such as sinus infections, tonsillitis, acid reflux, diabetes, and even certain types of cancer can cause bad breath. These conditions often alter the natural balance of bacteria in our mouth or release chemicals that have a strong odor. And lastly, let's not forget lifestyle factors. Smoking and consuming certain foods and beverages like garlic, onions, coffee, and alcohol can leave a lingering smell in our mouth. Understanding the root causes of bad breath is the first step towards combating it effectively. Remember, a fresh breath is more than just a social courtesy, it's a sign of good health. Now that we've understood the causes of bad breath, let's delve into how we can combat it effectively. Firstly, maintaining good oral hygiene is non-negotiable. Brush at least twice a day, floss daily, and don't forget to clean your tongue. These simple practices can drastically reduce the chance of food decay and bacterial growth in your mouth. Secondly, keep yourself hydrated. Drinking plenty of water ensures that your mouth remains moist, preventing dryness and stimulating saliva production, which aids in washing away food particles and bacteria. Thirdly, make regular visits to your dentist. They can help identify any potential oral health issues and provide professional cleaning to keep your mouth fresh. Fourthly, consider your diet. Avoid food and drinks that are known to cause bad breath. Opt for a diet rich in fruits, vegetables, and whole grains, which can help combat bad breath. Lastly, if you smoke, consider quitting. Not only does smoking cause bad breath, but it also increases the risk of gum disease and other health problems. Incorporating these habits into your routine can help you maintain a fresh breath and a healthy mouth. Remember, tackling bad breath is a continuous process, not a one-time task. Stay fresh, stay informed.